The fourth strategy is what we call the out-of-network model. So as an out-of-network provider, you do not have a pre-negotiated contracted rate with an insurer. So you set your own fees and patients pay you directly at the time of service. Patients typically become responsible for submitting their own bill or super bill or whatever receipt you produce in your office to their insurance company for potential reimbursement. It's always important, again, that we clearly explain how the reimbursement, clearly explain that any reimbursement depends on their individual policy and whether they've met their deductibles. So it is important to make sure that we're having this dialogue with patients. But this model gives you more control over your fees and allows patients with like PPO plans to still use some of their benefits. So for example, your PPO is your preferred provider organization. They're a health insurance plan that gives really a lot of freedom. They have a specific list of doctors and hospitals that they call in-network. The in-network, if you see a doctor or hospital, you'll pay less. The insurance company has worked out that lower price. The out-of-network means people can still go to a doctor who isn't on the list, and the PPO plan still covers some of the cost, but you'll have, slightly higher copays, insurance, or deductibles, but you don't need a primary care provider to be a gatekeeper. So if it's more about people being able to access services without a referral, and they also don't, again, need a referral necessarily to see a specialist, and in some states, chiropractors are considered specialists. So keeping in mind that we don't have to necessarily shut out everyone with insurance, there is the option for the out-of-network model.